Timer 5 minutes.
Respected judges, seniors, and colleagues, I'm here to present our novel portable tricolor chart that we've developed to screen suppression in schools. What we are trying to solve is a problem, if you look at it globally, a problem that would affect the entire population of Afghanistan, Sri Lanka, Nepal, and Bhutan. What makes it even more complex is that in developing countries such as ours, children get their first eye test possibly not earlier than the age of 10, and there is a skew in terms of the number of ophthalmologists available. Most children screening programs are dependent on teachers, they are overworked, and often most of these are only visual acuity focused. So we look to construct and validate a portable chart that incorporated the ETDRS and the dichoptic principles to look at both suppression as well as looking at monocular visual acuity binocularly in children. So we created these three charts. What you see on the three screens are example of a single optotype line where two screens had two red, two blue, and one black letter, and the third screen had three black, one red, and one blue letter, essentially 5 letters of each color. So what we did is we built it using a monitor with an Android box and put it in a trunk box because it would make it rugged and we could easily carry it out. We also attached a UPS supply so that we were not dependent on electricity going off. We validated this in a school screening program in a population of about 1,000 children, where we looked at the logma visual acuity, we confirmed it, and once we looked at suppression that we recorded, we also confirmed it using a Worth 4 dot test. So based on the distance of the Worth 4 dot test, the size of the suppression scotoma could be recorded, and we correlated that. So this is a video to show the principle, like we would do a Worth 4 dot test with a red and green glass, where immediately you see that where the child is suppressing, they don't look at it. We included children between 8 to 15 years who are verbal in knowledge of English alphabet, and data was analyzed. Uh, as I mentioned, we looked at around 1,000 children with a mean age of 11 and a half years. We found a high positive correlation between visual acuity measurements, and there were limits of agreement were very similar both for the right and left eye, although we recorded the vision binocularly. 14 children showed suppression scotoma, both using the Worth 4 dot and the digital eye chart. And sensitivity was 93% and specificity was 99%. We had one false positive and one false negative. We also were able to correlate the size of the suppression scotoma. School-based vision screenings are known to be effective and cost-efficient. Teachers often prefer to conduct using visual acuity. And there is recent research to show that suppression possibly is the primary cause of amblyopia, making it more important for us to screen for that. Although in this particular study we use letter optotypes, the same format can be used with numbers and symbols so that we can use it both in pre-verbal children as well as in illiterate population. We did look at the Worth 4 dot test. We can quantify it in clinic based on the size it sees and then converting it to log degrees. But this is very imprecise and time consuming and subjective. There is technology available in terms of apps that are there. But again, they repeatedly give the same stimulus to the child, changing the size. And again, there can be some amount of bias when children report it. Our results were very similar to detecting amblyopia as reported by Schmidt et al. Our chart is very novel in that it simultaneously tests both monocular and binocular visual acuity and also helps us to look for any suppression scotoma that the child may have. It essentially streamlines the entire testing process, and since we don't ask the child to cover one eye and they're using anaglyph glasses that are colored, we did see a lot of interest among all the children who actually volunteered to be a part of this test. In conclusion, Vision in the Box is a novel alternative providing consistent, reliable, simultaneous visual acuity measurements and can screen for suppression, and we hope that will become an integral part of all school eye screening programs. From a financial disclosure standpoint, we filed for a provisional patent for this idea.
Thank you. Thank you very much.